Dr. Christopher, are you on the show with us?
Hi there, Bill.
Hey, how you doing?
Hi there, Dr. Asandra.
Did that kind of motivate you to, like if you're working out or something, would that motivate you to listen to that? Maybe?
Yeah, I was getting a little groove in my chair here listening to that.
Yeah, I bet you. Like like your testosterone was really strong, huh? Like it was good.
Right.
Yeah,
right.
There you go.
Good.
It'd be nice if that's all you had to do. But I wanted to ask you, testosterone's gotten. In fact, there's lawyers on. They're saying, well, if you took testosterone and you're having problems, give us a call. I guess anybody can overdo it or not test for it or whatever. But isn't it safe if you use the Bioidentical or a good testosterone?
Absolutely, Bill. And you hit the nail on the head there saying Bioidentical. There's been a lot of controversy. You see the attorney ads that are on TV and all that lately. And it's based on a very poor study that was done a year or two ago. A lot of those patients that they studied weren't even on testosterone or continuing to use testosterone. They had diabetes and heart problems already as it is. And they actually just released a new study here. It's actually published in it was done at the UT Galveston, where they took about 26,000 Medicare patients, and it was published in the Annals of Pharmacotherapy. And they actually showed that men who took testosterone, of course it has to be done safely under a physician's supervision,
right,
actually had a 30% less chance of heart disease. And that totally contradicts the study that was out, published, that we saw at the end of last year. It just kind of debunked it. And, 2 years before that study, we saw another study that was done. It was in the Endocrinology Journal, and it showed that testosterone is healthy, and it did reduce heart disease and made men healthier. So, and like you said, Bioidentical, that's the important part. And I think most of those attorneys that you were mentioning about are going after the big pharma, the people using the creams that you got to put on every day, those smelly gels that you smear all over your chest, you smear all over your arms, you can touch your wives, you can touch your kids, and you're transferring a lot of that hormone to them as well. So Bioidentical means it mimics the body's natural release of testosterone. And I honestly think the best way to do that, if the patient can tolerate it, is Bioidentical pellet therapy, where they actually surgically implant, and it's a very mild, minor procedure, where you insert a few pellets under the skin, testosterone pellets, and you get a slow, consistent release of testosterone over about 4 to 6 months. And then you see the shots that are done at some of the other testosterone centers and all that, but you got to go in every week. You get the peaks, you get the troughs, you get the roller coaster effect of taking the shots. So I think, what we found is that the best response that we've had with our patients, the healthiest way to go, is the Bioidentical hormone replacement testosterone.
Interesting. So tell us about the actual Bioidentical origin of the testosterone that you use.
Yeah, so a lot of them are plant-based, and it's made from a testosterone compound, but they use a plant-based. That way the body can kind of not reject it. It's more natural to the body. And like I said earlier, subcutaneously, which means under the fat, you're placing these pellets under there. And we of course, we've got to check a person's testosterone initial level to see where they're at, to know how many testosterones we want to put in there, pellets we want to put in. Once we insert them in there, as the body begins to absorb, it's like this little pool of testosterone. As the body needs more, it takes more. And again, it's 24/7 release. Like I said, it mimics like what the body would do, in a normal day by consistently releasing a little bit of testosterone in the body. You put those gels and creams on, you got to put them on every day. If you think about it, you're going to spike probably a couple hours after you put on the gel, and then you drop again by the nighttime, and you don't feel well.
Well, I think you said something really important there. I hope people caught that. But if you take it orally in a tablet form or sublingual anyway, which is the way a lot of people used to do, or anyway, it's squirt up your nose, whatever. That's not the way hormones are released in the body, are they?
That's correct. And when you take something orally, it's got to go through the liver. A lot of those testosterone supplements that you take, first of all, you're probably not absorbing much of it if you eat it, and then a lot of it is metabolized through the liver, so it can be kind of harsh on the liver. Some people get elevated liver enzymes and all that. It kind of takes a beating a little bit when you do it orally.
So let's go over some of the benefits of using testosterone. I mean, women, they need testosterone sometimes.
Absolutely.
And Dr. Marianne Calvinese with me today. She's a doctor of naturopathy, and so I'm sure you see patients that are low in hormones of all kinds, don't you?
Sure. Yeah. So So tell us more about how you work up a new patient, how you assess whether or not this would be the right approach for them.
Absolutely. I think a lot of the other low T centers that treat low T, they tend to just take a shotgun approach. They check your testosterone, they may check a prostate level, and then they initiate therapy. I think it goes deeper than that, because if you understand how the hormone works, testosterone, as you know, Marianne, it can convert into estrogen or DHT, which is responsible for male pattern baldness.
Right.
So we check everybody right away. We draw their blood. We check their testosterone. We check their PSA, which is their prostate level, because if they have an elevated PSA, it's probably not a good idea to initiate therapy right away until a urologist clears them of any type of prostate cancer. We also check their glucose, hemoglobin, because as you know, the hemoglobin, which is your blood cell count, can rise once you start testosterone. And we got to monitor all that and make sure it doesn't rise too much. If it does, you need to go donate some blood. But we also monitor the testosterone levels throughout their treatment to make sure they're not underdosing or overdosing on the testosterone here. The goal is to find that sweet spot for everybody.
So how often would
each individual?
Normally, how often would you have people come in for testing?
Usually, probably initially when they come in for the initial consultation, and then about 6 to 8 weeks later, once the pellets kind of peak out. From there, we can kind of gauge where they're at, how they're going to do, and what levels are going to stay out for the next 3 to 4 months. And I would say probably after that, once every 3 months or so, just to kind of see how they're doing.
Mm-hmm.
We have seen so many lives changed from this as men get older. It just gives them energy. They feel like working out. They lose weight. And they just do better. If it's done properly, you got to make sure that you got doctor supervision. Y'all have doctors. Now you have one here in Austin, don't you? A clinic called NuMale, is that right?
Yes, sir. NuMale Medical Center. And I wanted to touch on what you said a little bit there. And the key word was doctor supervision. This is something you got to consistently monitor. It's not here's a prescription for some gels and good luck. I mean, right. Testosterone, it can be beneficial if it's done right. And like you had mentioned earlier, the benefits. I mean, one of the first things my patients see when they come in, once they start initiating testosterone therapy, is, Doc, my mind is clear again. It's this mental clarity. I have focus. I have motivation to kind of get up and do things. I'm pleasant to be around my wife now. She's not saying I'm irritable. And people at work notice I'm more productive. So it's key just to find out a doctor who's trained in this and understands how the hormone actually works, not just, oh, you're low, here's some testosterone, good luck.
Mm-hmm. Mm-hmm. Yeah.
If a person should they worry about prostate cancer and being on testosterone at the same time?
We tend to, they say that testosterone. Apparently, this is kind of old news. There's been no study that can show a direct link between testosterone replacement therapy and prostate cancer. Now, just on the safe side, because there's still some old, studies out there, Journal of Urology, et cetera, that say it may increase, it may not. If they have a high PSA and their prostate levels are high, go get checked out by your urologist. Go get checked out by your doctor first. Once he clears you, let's get you on testosterone so you can start feeling good again. But it's one thing that, is there a direct correlation? There's never been a true direct correlation between it. But it's still something that it's kind of a gray area, and we don't want to take a chance with those gray areas.
Mm-hmm.
When you say bioidentical, this is exactly the molecule that your body makes, right?
Yeah, it's similar to the exact molecule of testosterone that your body makes. Correct?
Right, because that's important to know, because a lot of these hormones where they got in trouble, they weren't the exact molecule, right?
Well, but it's not the exact molecule.
Right, it's not the exact person's molecule, no, but it mimics.
But it's the same. Would it be the same structure, chemical
structure? Yes.
Similar
structure.
Same.
Correct.
So how do you can't get the same molecule, I guess, a person makes?
Well, that's genetics. I mean, it's all in the genes there, how you express it. I mean,
right.
The hormones, the testosterone you have is going to be different than the ones I have, but the goal is to find a similar molecule that the body can actually absorb and utilize effectively.
Right, and that's what you're after.
Absolutely.
Right. Okay. So they can. How can they reach? Will they reach you or the clinic? Do you work at the clinic here in Austin, or?
I do. I work there, and I work at a few of the other NuMale medical centers that we have around the nation. First and foremost, check out our website, www.numale.com, and that's NuMale.com. Really easy to remember. We have several locations throughout the Midwest, in Vegas, Omaha, Albuquerque is our newest one. But the Austin one is located at 630 West 34th Street in Suite 301. And you can get a hold of us there at 512-607-7595. And, just call in, let us know what's going on with your... we also treat erectile dysfunction and other male-related issues. So, and all this can kind of tie together. And then we wanted to develop a comprehensive place where men could come and address all those types of issues in one place.
Now, I got this 607, 512-607. What was the other part?
7595.
7595. Or just best way is probably just go to NuMale, M-A-L-E, NuMale.com.
Yes,
and just go in, maybe... I'm 72, so of course I need to. I get checked and what have you. And that's important to do, and I do feel better when I do. So, but if somebody's in their 50s, or what would be a good age to start thinking about testosterone levels?
Well, it's kind of hard to say because after the age of 30, you kind of decrease about 1 to 2% a year. Mm-hmm. The goal is to find out the symptoms. Are you having the symptoms of low T? Because we honestly, in diabetics, if you're a young diabetic, we see lower testosterone levels in them. Guys who have more stress in their lives and they have more work-demanding jobs, they've got probably lower levels than someone 10 years older than who's taking it easy. So I think it's first and foremost, you need to look at the symptoms of testosterone, see if you're kind of matching that. And if you've noticed a change, or your partner, spouse, whomever has also noticed a change in you, I think those are some of the first signs. It's almost like self-diagnosis first.
Well, right. Even Viagra, something like that would be a sign. But also, we talked earlier in the show about pain medication that you take. That can lower your testosterone.
Yes, they've actually shown studies that, yes, actually that's very true, Bill. People who are on opioids or narcotics chronically tend to have a lower testosterone level than those who are not on it, and they have a lot more erectile dysfunction as well.
Dr. Asandra, pleasure talking to you. Got to get you back on sometime, but we got a hard break here to take, and I hope everybody got something out of this.